Republican Senator Orrin Hatch says the health care bill is unconstitutional, but that is just the beginning. We went to Capitol Hill, and Senator Hatch went on the record. Senator, nice to see you, sir.
It's good to see you, Greta.
Senator, I'm sure you've heard the news that Congressman Bart Stupak and others have been threatened or intimidated as a result of this health care reform bill. Your response or thought about that?
Well, people are really upset. They're really angry, and they really are tired of people making promises and then not living up to them. Bart's a good guy. I don't have any criticism of him, except I wish he hadn't done what he did, because that executive order isn't worth the paper it's written on, and we all know it. I don't know why he did that.
I take it that you're not thrilled at the fact that he's getting threatened, though.
No, I think people really have got to quit doing things like that. Look, these people, this is a tough job, being a member of Congress, and you're going to irritate people from time to time, but there's no excuse for anybody threatening a member of Congress. In fact, it's a real serious crime to do so.
All right, now let me ask you a hypothetical. Suppose I'm 25, in my dreams, of course, yes, I know. Suppose I'm 25, I have no health insurance. I know that if I get picked up or caught for no health insurance, it could cost me about $750 to $2,000 for a penalty. If I buy health insurance for a year, it's probably going to cost me more than that. I know that if I get really sick, that I'll get insurance at that point, because I'll be able to be added on as even with a pre-existing problem. So what's the incentive for me to buy insurance?
Well, there's not much incentives right now. On the other hand, for people who want to live in society and be respected, you really need to be a part of society by doing whatever's necessary to take care of yourself and your family. But some people can't do it. And look, Republicans wanted to help those people as well. What we didn't want to do is make it an almighty federal government program that basically never helps people the way it should.
But what's the incentive for the way it's priced? I don't understand the incentive. I understand the need for people to protect themselves and personal responsibility. But what is the way it's structured now? What is the financial incentive? Because if you get sick, you can get insurance at that point.
Well, the fact is, young people aren't going to want to do it. The financial incentive is that if they don't buy insurance, then they get penalized up to 2.4% of their gross income. So, this is the first time.
But that's less than the insurance is going to cost them.
Well, yeah, and that's what they're going to do. They're going to pay for that, and then wait till they get sick, and then of course we're going to have to count on society to pay the bill.
I know that you're opposed to the bill that has been signed by the president. Right. Your state attorney general has signed on to this lawsuit to challenge it on constitutional grounds. You're a lawyer. Your thoughts on it? Is there any legs to that, or is this just sort of flailing by some unhappy attorney generals?
Well, back on Hillary Care, they had a mandate in there, and I didn't realize it. I didn't pay any attention to it. We were trying to defeat Hillary Care. But the more I studied it since then, the more I've looked at it since then, the more I've come to the conclusion that it would be absolutely unconstitutional to force people to buy something they don't want to buy. It'll be the first time in history that the government could tell you that you have to buy something you don't want to buy. Now, they say, well, but you have to buy auto insurance. No, you don't. You don't have to drive if you don't want to. I mean, that's just a part of the privilege of driving. But in this case, they're going to make you buy insurance even though you don't have any desire to, you don't have any reason to, and frankly, it would be the first time that your liberties would be taken away from you and where you'd be forced to do something you don't want to do. I just don't think that's constitutionally sound.
In the event that the judge agrees with you and it winds all the way up to the Supreme Court, and let's say the Supreme Court agrees with that position, is this the type of issue that will defeat the entire health care bill, or will it simply defeat that particular issue, the required mandate?
Well, one of the things about this bill is the mandate's a big part of it. They want to just force people to do whatever they want them to do. Now, that's what you call totalitarianism. It's not really a good government. And, in this country, we believe in liberty. We believe in freedom. We believe people ought to have choices. We believe that they can make their own choices. If they choose not to buy something, that's their privilege. They can suffer the consequences for that if they don't. But if they choose to buy it, then that's their privilege. But to have the government come in and say, you're going to have to buy this or we're going to penalize you. Well, that's not America. That's not what we believe in. That's not what helped to develop this country. And I understand the arguments behind mandating and everybody's got to buy insurance. But then it comes down to what kind of insurance. A policy that the federal government designs for you, they're going to make a big determination as to what kind of policies you're going to have. I mean, you basically lose your individual freedom if government can tell you got to buy something you don't want.
Senator, I take it that there's, I mean, you recognize there's been a lot of hostility and tension up here in Capitol Hill the last 10 days or so, probably even longer than that. Is it chilling out a little bit this week, or is it still hot and heavy up here?
There's a lot of animosities up here and a lot of bad feelings, and you know, there's euphoria on the part of the Democrats because they were able to get this bill through. And if you look at it, in the history of this country, we've never had a major sweeping piece of social legislation that is any good that's been passed by just a partisan vote. And Republicans want health care just as badly as they do. But we think we should have started over and gone step by step to bring in the things that we mutually agree on first and then compromise on the things that we can't initially agree on. And that's how it's done around here. That's how it should be done around here. That's what brings people together. That's what gets rid of the animosities. That's what helps us to become functioning Americans working together. But no, they were going to ram this up our noses no matter what happened. And they've succeeded, but now let me tell you this. Everything that's wrong with health care from now on in is going to be the Democrats. They're the ones who did this. They're the ones who are pushing this all over America. And I think they're going to pay a heavy price for it over the years. But, you know, right now there's a lot of euphoria on their part, but that euphoria is going to go when people start realizing what they've done to them.
So, Senator, you got Press Secretary Gibbs jabbed you a little bit on this mandate.
Yeah, he really did. I guess he forgot that just a few months ago, last year, during the campaign, the president was criticizing Hillary Clinton because of the individual mandate in her bill. We actually had an individual mandate in ours, apparently, but I didn't realize it at the time because we were interested in stopping Hillary care. Now, you know, it's just like a lot of the president's promises. He promised that people earning less than $200,000 a year will not have to pay any taxes under this bill. Well, about a quarter of American people are going to have to pay taxes under this bill who don't earn $200,000 a year. And there are other aspects of the bill, too, that he's kind of had to back off on. And I might add that the president was against the individual mandate and criticizing Hillary Clinton for it. And I think he was against it at that time in a right way. He was right at that time. But funny how things change when you're out to try and pass something that's totally partisan, that basically the American people don't want, and that you think you can put over on the American people.
Next, the best of the rest.